So happy evening to one and all. So as all we are undergoing so many ups and downs in our life, so sometimes we feel we are so happy and sometimes we feel so lonely also. So everybody will experience that loneliness. That too, as the age grows, due to some reasons, our children will go away for studies or work, and due to aging, our loved partners will we will lose the partners also. So the particularly the older age people may feel so much of loneliness, but I won't tell everybody to feel that, but most of the people will go through that. So today our guest is Dr. Saraswathi Tenagi ma'am. She'll be explaining regarding the loneliness in elderly. So I'm happy to have her here. Welcome ma'am.
Thank you, Komala, and good
So
evening, all.
good evening, ma'am. I'll give some brief introduction about our Dr. Saraswathi Tenagi, ma'am. She has done her MD in psychiatry, PhD in neuropsychiatry, and received gold medal as All India topper in postgraduate diploma in hospital management. And she published and presented so many papers, worked as DMHP officer, district surgeon, assistant professor in Medical College, Belgavi. Currently working in Belgavi Institute of Medical Sciences as associate professor, and also she is one of our core member in the VMS NIMHANS. So welcome once again, ma'am. Handing over to you, ma'am.
Good evening, one and all.
Good evening, ma'am. Good evening. Good evening. Good evening.
അതന്നെ
Good evening.
Hello.
വാർത്ത
Hello.
അയ്യോ
Hello.
Yes, ma'am, you are audible.
I'm audible. Some disturbance was there in the background.
Yeah, yes, ma'am. I muted.
Okay, okay. Thank you. So, good evening, all. And today is a pleasant day, and I'm here to share my views on loneliness among elderly. We all know that aging is a series of processes that begins with life and continues throughout our life. And the definition of health when it comes to aging, uh, especially when it concerns to old age, it's a subject of debate itself. Health in old age, we cannot meaningfully be defined as the absence of disease. And we all know that old age comes with its own group of many diagnosable long-term disorders like diabetes, hypertension. So health in elderly needs to be redefined. Successful aging. So what is aging and successful aging? And most of the time aging is accompanied by so many concerns like health decrease in cognitive abilities, social connectedness, reduced mobility, loneliness, and so many other challenges. And World Health Organization has emphasized on the importance of healthy aging with a comprehensive approach of well-being that incorporates both physical, psychological, and social domains. Successful aging incorporates the idea of growing old with positive orientation towards life, which consists of good health, a very good functional capacity, autonomy, acceptance of self and others, deriving a sense of purpose in life, and engaging oneself in healthy social interactions is instrumental. Let's try to understand what is loneliness, what is social isolation. Are they two different entities? Are they same? Social isolation is objective phenomenon, which is like defined as where the individuals have minimal contacts and positive social relationships and social engagements. Whereas loneliness is different. It's a discrepancy between an individual's desired and achieved levels of social relations and how the person perceives is different in different individuals. Let's try to understand the prevalence of loneliness. India, we know that with the growing population, The amount of geriatric population, it contributes to 1/4 of the global population. The elderly population, it is projected like by 2050 to rise by 319 million in India. And according to Ministry of Statistics and Program Implementation, Government of India 2021, approximately 13% of the population in India will comprise adults aged 60 years and above. The prevalence of social isolation among elderly in India is almost 34%, and research evidence show that there is a rising trend in this phenomenon, and we have various reasons for the same. The prevalence among Indian elderly is also alarming, with almost 55.4% of the elderly adults experiencing or reporting loneliness. Social isolation and loneliness are serious, but they are still under recognized, underdiagnosed, and underrated phenomenon among elderly adults. So, what is successful aging? Successful aging, it incorporates the idea of growing old with positive orientation towards life, consisting of good health, functional capacity, autonomy, acceptance of self and others, deriving a sense of purpose in life, engaging oneself in healthy social interactions, which I mentioned earlier. So, the components are basically the psychological well-being, which is essential in the declining years of life. So, what is psychological well-being? It's a positive psychological construct which is related to subjective view of oneself and life. There are various models which define what is psychological well-being. One model says that there are 6 components in psychological well-being, which is the meaning, purpose, direction people give to their lives, autonomy, personal growth, mastery over one's environment, maintaining positive relationships, self-knowledge, and self-acceptance. Further, Seligman has defined, he has proposed another model of psychological well-being, which says positive emotion, engagement, relationships, meaning and accomplishments are the components of psychological well-being. So we can see from these models of psychological well-being that they have focused more on engagement and social relationships. These are the key attributes to achieving psychological well-being. And our default mode of human beings is social. We are all social animals. So when human beings are, when we engage in meaningful and pleasure eliciting activities, it enhances positive neurotransmitters, hormones, and thereby improves individual's sense of well-being. Healthy relationships are basic human needs that are crucial for a meaningful life. So therefore, we need to maintain positive and meaningful social relationships among ourselves. So these relationships, they promote love, intimacy, and strong emotional and physical interaction with others. It can be our friends, it can be our relatives, or those who stay with us, like in old age homes, staying with each other together. But however, there are many factors impacting these attributes. How can loneliness, there are many reasons why loneliness happens, why it happens, how it happens. It's very difficult to explain. There are many factors contributing to loneliness, and we can quote so many reasons. Emptiness syndrome, even social connectedness is there, but still detached from the family. So many components. Children living out of the house for study, for work, grandparents staying alone, parents staying alone, or the loss of loved ones, or the partners, friends. So even retirement. So all these, sorry, social animal, it's general construct, sir. Not in, please do not take it in a literal meaning. So shall I continue?
Can I ask a small question?
Hello.
Am I audible?
Yes,
Am I
yes, sir.
audible?
Please, sir. Please go ahead and.
See, there is a amount of fear comes when you are left alone, especially during the nights. See, because our strength is going down by every age. So when the darkness sets in, there is a some fear grips in, and when you are left alone, when you feel scared and you are almost crying. So how to overcome such loneliness? For elderly, I'm a person of 89 years. Sometimes I feel left alone because the helper had gone on leave for several days, for more than a month and all. So how to overcome such things? Fear, left alone.
Sir, I'll come to those points after 5-10 minutes. I'll talk how to overcome loneliness. Definitely, I'll cover these aspects, sir. So, what are the health impacts of loneliness? So, there are many physical as well as psychological impacts. Those who are lonely, they are more prone for stress, stressful life events, adverse events, and they're also more prone for many conditions like diabetes, hypertension. There is increased risk of heart disease and stroke. It can elevate the risk of cardiovascular problems because basically it impacts on stress hormones and inflammation. Stress levels are increased, and hormones like cortisol leading to increased blood pressure and other physiological responses which are associated with stress. Immune system is affected. So when we see elderly patients with loneliness, they are more prone for many infections. So the immune system is compromised. The sleep quality is affected. There is reduced sleep, intermittent sleep disturbances, early morning awakenings, and this reduced sleep quality comes with its own negative health consequences. And even mortality risk is also increased. So, what happens to our psychological well being when we are lonely? See, when we are lonely, it affects depression, anxiety, aggravates the which is already existing and which can also have a newer diagnosis of depression and anxiety. And studies have shown a clear link between loneliness and cognitive deficits or cognitive decline, like memory issues, what many elderly people complain. So it can also give rise to many other psychological disturbances like suicidal thoughts, self-harm, reduced confidence. So it has its own impact on both psychological as well as on our physical health. So far I have covered on what is loneliness, how it impacts. So let's try to understand, is there any difference between loneliness and solitude? So what is solitude? Is it different from loneliness? So let's try to understand, because many people prefer to be alone. So Solitude is conceptualized as being alone. Sometimes we see many people, like when we visit restaurants, there are people who sit alone for themselves and they will be enjoying their food. So it is more like spending time alone. Many people take this time or being alone or this me time for themselves, where they try to reflect, being our own self, being all by self. So like trying to reflect on our own thoughts, spiritual sustenance, opportunity for us to engage in long ignored thoughts and feelings to emerge, chance to acknowledge our fears. So reflective, thoughtful time on our own can be a time of solitude, but this is different from loneliness. So in loneliness, even when we are with people, we can still feel alone. So sometimes solitude can help us to understand ourselves, whereas loneliness makes us feel very sad or depressed. Sir, any questions? I would like to have interaction with people. I would like to hear the experiences of the...
Doctor, what is the remedial for loneliness? That is the loneliness. More than 60, 70, 80 people are mostly loneliness without any
Yes, sir.
association.
Yes, sir. Yes, sir.
Without any
And there are
association.
many reasons. Changing social
Yeah.
dynamics are contributing to loneliness among elderly. And
Yeah.
surprisingly, even our youth are also facing this problem, sir. Not just elderly, even our youth. Though they are socially connected, like they may be having hundreds of friends on social medias, but when it comes to real friends, they lack real friendship. Current
Very
generation.
low percentage, very low percentage. Either friends or relatives. Actual when we need, then only we would like to know the real friendship or relationship.
Yes, yes, definitely, sir.
That's why what is the remedial measures as per your concern, your experience, and all these things.
Sir, I'll talk how to overcome loneliness, definitely. But I want some feedback from the others also. Like, what are their experiences, like their friends or any relatives who are suffering from loneliness and how they are coping with the situations.
Am I audible, madam? Good evening, doctor. This is Jampunathan.
Good evening, sir. Good evening.
Doctor, I mean, our one of the participants has raised very important question because I know him very well personally. So yes,
Yes,
see,
sir.
this is the experience. If you are asking me, the experience that some of us face, especially when we are facing this loneliness. I have, of course, occasions to deal with such people also. That
Yes, sir.
they do not know what to do. See, they have got lot of time before them. They really do not know what to do. What they do is they just, try to sit before their TVs and spend time. And without any reason or anything, they just start crying. They suddenly they become over
Very
emotional.
emotional. Yes, yes.
Emotional. So these are all. I mean, this is one. The emotion is one way of expressing somebody's loneliness, doctor. This is my experience.
Yes,
See,
yes.
if
Definitely, sir.
so in addition to this, low experience, in addition to this expression, can you just think of any other expression through which loneliness is, shown? And to some extent, I feel that this loneliness also drive people to suicidal tendencies.
Yes. Yes.
Yes, what is I have? They do not have any self-worth. They say that what is that I'm going to achieve by living? So I have already achieved what all I have. I can. God is not on my side, etc., etc. That's what they think that they why should I continue in my life? This kind of thinking also comes, doctor. This is I mean it will be very useful if you can deal with this situation also, doctor. Thank you.
Sir, thank you very much for all the input and feedback you have given, sir. This will help me probably improvise my presentation or talk. Thank you very much, sir. So
Thank you,
how to
doctor.
address, see, all this time we spoke how common it is, how people are facing loneliness, how it is difficult for the elderly to cope up with loneliness. It's very difficult. Definitely, it's a very difficult task, and
No, but to be frank, I am Shivaguru from Bangalore.
yes, sir.
I am 73. So I
Yes,
lost
sir.
my 8 years. 8 years back, I lost my wife. My daughter, only daughter, she is a doctor and she is busy morning to evening. To be frank, 24 hours I am alone.
Yes, sir.
So only problem is that you have to make yourself busy. It's not possible from somebody from outside will not come. Because of this Corona and other things, maybe it is a boon or not, I don't know, but a lot of seniors groups have come up online. I am a member in 5-6 senior groups.
Yes, sir. This is one way to have a social connectedness,
Yeah, they have
connections.
lot
We have
of
to
programs. Morning to evening, they have got a lot of programs. So
we have to
morning it's
encourage lot of social connections. Yes, sir.
yeah. That's why I keep myself busy with one or other program. This program is also because of some connection. I came and I'm attending these programs every Monday. So otherwise, in Nightingale Medical Trust, every day, every alternated 2 hours, 1 hour cognitive activity, 1 hour physical activity. If you go to some other seniors, you go morning 8 o'clock or 9 o'clock, 1 hour yoga practice is there. Otherwise, there
Yes,
is a
sir.
singing, there is singing, dancing, drawing, cooking, whatever you want. Many things are available. As per your interest, you can take part. You can keep yourself busy for 4 to 5 hours minimum. You will be able to keep yourself busy. So keeping yourself busy is up to you. What you want to do. If you feel that you have got
Yes,
nothing
sir.
Yes,
So, as suggested by, we have to foster like how to address. So, one is by fostering social connections, community engagement. So, encouraging participation in, as mentioned by our participant in senior centers, clubs, volunteer opportunities, and social events. So, it can create a way of interacting with each other and it builds a sense of belonging to each other. So this is one way, and we need to understand that there are a lot of generational gap and communication gap among our successive generations. So we need to bridge this gap, this intergenerational gap. So how to bridge this gap? We need to have a combined group of activities where all groups or all generations or people are involved. So bridging this gap between generations through programs where seniors people as well as younger people together, it contributes to mutual understanding and support. And social prescription, there is something called social prescription where individuals can connect with other groups and engage in some social activities. Yoga, it can be yoga, music, drawing, anything whichever interests. So I would like to say that all these activities may not be equally applicable to all of us. So whatever activities or interest we have, we can connect to those people. There are many senior citizen groups, age-friendly groups, which engage in activities for senior citizens. We need to seek out. Even we can have a music group or community health group. So many such. There are green saviors. where they go on planting trees once in 15 days or once in a week. And some groups are engaged in other like school activities. There are so many activities can be incorporated. This is something called social prescription. And support groups, of course, to offer opportunities for older adults to connect with others who share similar experiences, and providing a safe space to share feelings, to share our feelings, to vent out our feelings with each other, and building strong relationship. So we need to befriend the services who can provide regular companionship support either in person or through virtual means, and promoting engagement in meaningful activities like hobbies, interest, whatever is the hobbies and interest which interest the individuals. So like even it can be anything, gardening can be a good activity, painting, reading, so many cultural events. So we need to stay active, promoting physical activity through like walking groups. Walking groups can be organized, exercise classes and other activities. And this is an opportunity to learn new skills. So many small things we can start learning now, for which we did not have life in our prime years. So we also need to have digital knowledge for our elderly people. So this accessibility knowledge about the digital use is a must for the elderly people. So they need to understand the use of smartphones or tablets, and to provide training on how to use them for communication and social connection. So technology should be accessible. So some services we can have home and community based services, like for severe elderly, those who cannot, like mobility is restricted, they cannot come out of the house. So we can have community based services. Definitely mental health is very important, and the elders, they need to come out, talk about their feelings, share their feelings with whoever they are comfortable. So this helps in overcoming the emotional and psychological impact of loneliness. And definitely we all need caregivers. So caregivers need to understand. And of course, we need to have age-friendly communities. So accessible environments. So public spaces should be accessible to senior citizens. Transportation should be accessible, and even the housing. So where there is no difficulty for the elderly to move around. So those elderly adults where they have limitation in their mobility. And most important is we need to raise the public awareness of how elderly people are, what they are going through, what problems they are going through, what are the impacts of social isolation and loneliness on the health of the elderly is a must. So public awareness, creating public awareness. So these kind of activities which is disseminated, these, my personal opinion is, this Vayomanasa Sanjeevani, we should not restrict it to only for elderly. It should be accessible even for the younger generation, so that they need to understand. They need to know what is going on with their elders. So collaboration with government agencies need to understand the provisions, laws related to elders can come a long way in addressing these issues. So anybody would like to contribute their experience?
Hello.
Yes, ma'am. V.
Madam.
Subramanian sir was wanted to ask some question.
See, if a person is extrovert, then keep oneself busy and it is feasible with all this activity. If the person is introvert and feels helpless to find out these ways, how can this be addressed?
Sir, when a person is unable to access the social connections, we need to examine him or evaluating if they are going through depression.
And
Like
depression is there.
loneliness, yes, loneliness can lead to depression, and depression can in turn make them even more socially isolated. It's like a circle, sir. It's like a circle. Loneliness, depression again you become lonely, or you prefer to be alone. You don't want to interact with the people. You don't want to talk to people. Again you become depressed. So it's like a circle. We need to break this circle somewhere. We need to identify those patients or those persons, whether it is only social isolation and with social connections. If they can come out of the loneliness, it's well and good. But if they're suffering from depression and they have symptoms suggestive of depression, they need to see mental health professional, they need to be evaluated for depression, they need to take treatment, like both pharmacological as well as psychological, sir.
See, the thing is that he used to say he feel like not doing. He used to be a very active person involved, but presently he says I feel like not doing anything. His wife is also not well. He has to attend to her regularly. So how can it be addressed?
Yes, sir. Definitely, the mutual understanding is very difficult. So, this kind of support is very difficult to address.
Because he is far away, I am in Bangalore. So we used to interact over phone. I'm just explaining an experience. We wanted to know. So how
Yes,
can
sir.
this be addressed? But he has been a very successful person. He has been all along successful. Now presently, that is the condition. But is it, he's telling he's not able to do anything. But he used to be a good writer, everything. But the only present situation is wife is not well, he is attending to her.
Mhm. But still, he like talks to people over the phone at least.
Talking to the people, yes. But only thing is, I told him I'll come and
Sir,
stay
is
with
there
you
any
for
restriction of movement?
restriction movement is there. Wife's restriction is there. That's why he's not
Uh-huh.
able to move around a lot. But he
So,
goes for walk and comes back home.
okay. So, he takes a walk. So, you can form a walking group from the nearby
No, he is
homes.
going for evening walks, sitting with somebody. But many times he has to attend to his wife. Wife is not well. She is not in a position to move around.
Hmm.
So he has to
Each,
help her out. And the children are far away. They are abroad.
they both need the services of
They are
mental
well
health
educated.
professionals.
They are all well educated and
But
knowledgeable.
I feel they need to talk to a doctor
Okay.
in person so that their issues are addressed. Because, sir, there are multifactorial. We cannot
Okay.
pinpoint to one particular reason, or this is the only reason which is causing loneliness, or this is the only reason which is causing depression. There can be so many other factors, like because of medications, because of their chronic illnesses like diabetes, hypertension, heart diseases. All this can also cause depression, and they just don't feel like going out of the house. And so the psychological impact is very huge. So they need to come out and talk to professionals better.
Okay. Okay. But just I want to share with you the practical experience.
Yes, sir. Yes, sir.
That's
Even
it.
I have seen my own in-laws.
Yes, it's there. It's there. That's what I just to see. Many
We,
times
I,
it is only they have to find out the solution themselves. But we cannot suggest them to go and see
very,
this one
very
doctor
difficult, sir.
also. That is
Very
the other
difficult.
way a problem also. That is it.
Very difficult, sir. Very
I
difficult.
suggested
And
him I'll come and stay with you for some time and we can. For that also he is not liking that he wants to be independent. He doesn't want to show that he is helpless. That is the condition. Just I wanted to share with you.
some people like very difficult to manage. Like they need to understand what is the self-awareness is very important, sir.
Okay.
Self-awareness.
That
What is happening to me?
Yeah, that self-awareness we need to create in them, doctor. That's the only
Yes,
problem.
sir.
That self-awareness we need to create in them. That self-awareness. But what happens, doctor, as he was
Yes,
mentioning, see, there is still some stigma attached to going and meeting a mental wellness professional. See, that is the real problem. And as you very rightly said, he might be having some inherent problems. Some physical problems also could be there, like blood pressure, or this thing, arthritis. Arthritis could be also present that may restrict his movement. He may put the blame on his wife, but still he is not moving much. Therefore, it's a as you rightly pointed out, it's a multi-factor one. Therefore, definitely, at least he has to meet his health professional so that he can suggest him to go to a mental health professional. That is one that. And secondly, you made a beautiful suggestion that this Vayomanasa Sanjeevani should be open to all, youngsters also. It is not, we are not restricting this to old people alone, doctor. We are, it's open, doctor, but the only problem is that the timings that we conduct this is between 4 and 5. And this is not the time that you can expect an youngster to come and sit. He is there still in that age, earning this thing, and they have got their own schedules. So in that context, making them come to these kinds of meetings is very difficult, doctor. Even
definitely, sir. I agree, sir.
Yeah, we are seniors, we are not finding it easy to make them come for this. Because, okay, they say, sir, okay. And, these kinds of things, one more thing is that what we can do at best is to create some awareness and knowledge. But it is not, we cannot give a prescription here. The prescription has to be taken by them by visiting a doctor. We cannot prescribe you take this medicine or that medicine or something like that, because you need to examine a person in full. Then only prescribe something to them. Therefore, we can only talk about the major impacts, etc. Therefore, making even the elders to attend this meeting is becoming difficult, doctor. That is the only thing I wanted to share. But anyway, it's a good suggestion. We are trying to involve as many youngsters as possible, doctor. Like you. Like you are involved. So we are involving actually many people also, doctor. Thank you, doctor.
Yes, sir. Actually, sir, when we age, we need to prepare ourselves for all the consequences. We need to prepare ourselves. We need to increase our social connections. For example, a working person, he retires at 60. So after retirement, suddenly he's like, his mind goes blank. Oh, what to do today?
Yeah.
I don't know where to go.
Retirement strikes a
it's like a sudden change in the life itself.
Yes.
Many people go into severe depression because of this phenomenon. This retirement, and the next day you don't know what to do.
What to do, yes.
So we need to start preparing ourselves from our 40s and 50s itself. So we need to increase our network, family, develop some new hobbies, keep ourselves engaged in whatever limitations we have, whatever we can do in that limitation only. Try to choose whatever hobby which which we can like and engage ourselves. If we can start that activity very early, probably will not be facing loneliness in future.
Exactly, doctor. Correct. You are exact. So in fact, many of the people now, even by 50th year or something like that, they start preparing for retirement. Preparatory.
Yes, sir.
They are retirement. Yeah. And Rangavatal was asking something question, doctor. See, Rangavatal is a very senior person.
Yes, sir.
He's retired from the postal department in a very, very senior position. So, yeah. So Rangavatal sir, you asked some questions, sir?
We developed some kind of a OCD and other mental illnesses. Left alone, see, because my helper was on leave for several months. So while I was left alone, I was very much scared. So just I wanted to have some tips from the distinguished doctor.
Sir, elderly people who are suffering from chronic mental illnesses, definitely if caregivers are not there, if family members are not there, it's a good thing that they should stay in elderly care homes, take treatment from the professionals, and be in a social community, be in a community living. It's very difficult for such people to stay alone, manage their illness as well as their loneliness. It's very difficult, sir. So if there are no caregivers, no family members, it's better or advisable for them to live in elderly care homes.
Could you all arrange for some tech training for us elderly?
Sir?
Could you arrange for some tech training for us elderly people? Tech training, how to use a laptop, not just to use a laptop, how to do Excel sheets, how to do email, how to do lots of things. All the
Digital literacy is very essential now, because we are hearing of so many cyber crimes, cyber frauds where elderly people are targeted. So we need to really, there is a need for digital literacy among the elderly, and we need to plan. And if you people are willing, I can definitely arrange.
Are you in Bangalore?
No. I work in Belgaum.
Yeah,
Madam,
sure.
for
Yeah,
this
sure, ma'am.
cyber
From NIMHANS,
for cyber training, Nightingale and the police department have arrangements, and oftenly they will be calling us. So they voluntarily come. That shall be. Will you arrange some people to join? We will come and train you about cyber fraud and even use of gadgets and tools, etc. Number one. Number two, police department has the provision for lonely people. Every month they visit their house. So once in a way, they can get their groceries, etc. by paying them. They will come and assist once in a way, mostly monthly once. That provision
Yes,
is
sir.
there. They have to enroll their names in the police department.
Yes, sir. Yes, sir.
Nearest
They have
police
to enroll
station.
in the nearby police station.
Thereby monthly they will arrange officially. They will arrange a person who will go there and he will ask for the details, and he will arrange some material purchase, etc., etc. Or taking to hospital or something like that once in a way, not regular basis, monthly at least once. That what police department people told us. So, and even that from our association they took the list who are all the people who are lonely, names we were to give to them. If our member agreed, then we gave it one or two people, that's all, only persons available in the residence. So like that, lonely people can take this society into confidence, and police department in particular. Nightingale and the Department of Police is always Assistant Commissioner of Police, Sir Dayanand Sir. He made a lot of programs called most of our seniors, and he emphasized a lot on. Unfortunately, he has been, the politics of it. Let us not talk about that. Unfortunately, he is in. He was for senior citizen. Oftenly, he was arranging a meeting for us and explaining the whole thing in the infantry road office by providing all the details by one or two three people will be talking. Then ultimately, he used to conclude what seniors should be, how one should taken care, and once how he should take the help of Nightingale NGOs and other things. So otherwise, see, very difficult. They have to cope up with some dependable friends, police department, and the senior Vedikas or senior club, like that. They have to manage. Government, we cannot expect too much from the government, except occasional visit and getting some items purchased for them.
Sir, you're not audible, sir.
Hello? Yeah.
Hello, sir. Yes, sir.
Yeah, I think that's all. That's what I.
Doctor, one suggestion. Instead
Yes,
of
sir.
inviting school children, youngsters, a team of persons can attend schools and colleges and explain the conditions of the senior citizens during their annual function or special functions like that. Interested speakers can attend and tell
Yeah.
them what is
Yes,
the
sir.
interest of
Sir,
Yes, sir. Very good session. We are
let
doing,
me.
sir. We are doing what you told is we are doing through Akhila Bharata Grak Panchayat. We are going to already we have attended for 4-5 schools, and now ninth also we have fixed 2 schools for high school students, wherein mainly we inform about the consumerism and the food safety. And what you told also that we will try to include to help seniors. The boys who are in 10th and PUC, they can take some initiative. Thanks for your point that we will also include. Only now food safety and consumerism, we are giving awareness program through Akhila Bharati Grahak Panchayat.
But
Sir, I would like to
Very good
share.
session, sir. Very good
Sir, I would
session.
like to share my experience regarding this issue. During when I was in Mysore and my children were studying in Maharshi Public School, Mysore, and there one particular day they invited. They said there is a grandparents' day in the school, and all grandparents of the children were invited on that day, and they celebrated it like a big function. So many children came with their grandparents, and many grandparents who had 90 plus were in fact honored, and who had achieved something. Their achievements were recognized in that platform. I think we should have something like this in our schools, where the children are also proud of their grandparents. Yes, these are our grandparents, we stay with them, we learn from them. So this kind of activity, I feel, should be present in our schools, where should be encouraged. This is my personal experience, sir.
Yes, doctor. This is nowadays being conducted in most of the schools, doctor. Most of the
Yes,
schools
sir.
they have.
Yes, sir. Very, very essential and needed, sir.
Yeah, yeah. It's conducted. It's being conducted, doctor. But but it's these efforts are only at some private school level, etc. It is not
Yes, sir.
taking up as a grand movement or something like that. I think we need to propagate that. Thanks, doctor. That's a good suggestion.
Yes, sir. We should have, sir. We should celebrate our the presence of grandparents.
Yes.
I think we are having a very good interactive session, and many suggestions are coming, and even I feel I'm very happy I had this interaction. We can, I would like to incorporate many of these suggestions in my hometown. I mean, in Belgaum, where I can interact with many senior citizens. Where we recently had a ladies group drawing program, where we had 1 hour, where all the senior citizens were called on that particular day. They were provided with painting and brushes, and they were asked to draw. So that kind of activities can encourage many senior citizens to come forward, interact, and it enhances their social connectedness, and can address loneliness.
Exactly, doctor. And in that, they also get some new friends.
Yes, sir. Yes, sir. They made new friends.
Yeah, they get new friends and they become more. In fact, we try to do it in various our RWS, that is Residents Welfare Associations. We create this seniors group. So for these
Yes,
seniors,
sir.
At least once in a month, we used to say that this is the seniors, we will meet, try to do something, and involved in some activity. Some we are all doing stuff. But again, as I said earlier, it's all happening here and there only, and not on a big movement basis. And that very unfortunate is that there is a rural disconnect. And the rural areas,
Yes.
these things are not at all heard. That is the rural, the number of senior citizens in the rural area are huge.
Definitely, sir. There definitely is rural urban discrepancies are huge. Many children, they have left their parents in villages and they have moved to city areas, and yes, sir.
Yeah,
We need to have such activities in rural areas.
Yeah, and even yesterday we were discussing in our group this. What is happening is today the income of the person, especially the lower middle class person who is just sitting at the city, is barely sufficient to take care of himself and his wife, children, etc., etc. In that context, he is not able to bring the parent to his city, nor he is able to go and sit there. See, this kind of a thing is now becoming a big problem now.
Yes, sir.
Somebody has raised one question. Let's see. The chat. Oh, yes. Yeah. So any other person has got any other point to share? Thanks, that was a very wonderful session in the sense that you are able to listen to what we like to say. That's great. Normally, these are all the sessions where we hear from you. But it's good that we also were very open and just asking people to come out with their suggestions. That's great, Doctor. Thank you. And it was a great
session. Thank you.
It was a great session in the sense that, yes, you have many points.
Thank you so much, sir.
Yeah.
Thank you so much.
Thank you, sir. Thank you all. Because it's a learning experience for me now. I'm growing old. I need to incorporate these things.
In fact, the normal thing is that only in all these interactions we learn that. Whatever, see, 1/4 of the learning comes only, there's a Sanskrit poem which says that the 1/4 of learning comes only from your movement with other people. See, they say that Acharya Padam Adatte Padam Sishya Swamedaya Padam Sabrahmacharbihi Padam Kala Kramecha. That is a sloka. See, that they say that 1/4 is only the teacher can teach. The 3/4 other things are coming only through your interaction with 1/4 by interaction with your people. 1/4 is your own self, this thing. And last 1/4 is your experience. And your experience also speaks that. Thank you.
Yes, sir. Because I've seen many of my friends, like senior friends, they have formed like movie club. They once in a month, they go to movies together. They form a group of 8 to 10 people. They go to movies together. Then sometimes they even go on group trips, like 60+ people. So we need to create these kind of opportunities for senior citizens with our friends. It can be our relatives, our colleagues, anyone actually. In fact,
yeah, that's great, Doctor.
And we need to have friends from all walks of life.
Yes, not only our generation.
Yes,
especially the people of younger generation also, because we learn many things from them.
Yes, sir. Yes, sir. We need to learn from the new generation. Basically, their way of thinking is totally different. So we need to bridge that gap, generation gap. We need to learn from them.
Yes, and their communication is totally different. So I cannot really understand what they talk.
So we need to, sir, accept the changes in life, the dynamics of life, accept it, then adjust.
Yes, Doctor.
Adjustment.
Yes, Doctor. This is one.
Thank you, sir. Thank you very much.
And we need to continuously
adopt. Yes, sir. Adopt. Yes, sir.
Adopt, change,
yes,
adapt. Like
yes, sir. Yes, sir. Thank you very much, sir. Thank you all.
Thank you, ma'am. Thank you, everyone. Thanks for such an interactive session. If anyone is having any doubt also can clear. 2 more minutes.
Regarding Grandparents' Day, some more light can be thrown. Where are
Yes,
they
sir.
practicing?
I
In the
didn't
school.
understand.
Some
didn't-
Grandparents' Day has been celebrated in some of the school. Maybe in Belgaum, I don't know what Dr. Saraswati Madam was telling.
No. So it was not in Belgaum, sir. It was in Mysore when I was there in Mysore.
Yeah,
So
nice.
back then.
Okay, Mysore. Okay then. No, because I have some program on 9th, conducting awareness program on food safety and consumerism to high school students on 9th of
Yes, sir.
Kakodu and near Rajan Kunte High School, 2 colleges, government schools have been
Very
selected.
nice, sir.
And
Very
we
nice,
are
sir.
going along with Gayatri Nadig. She is the secretary. I am the vice president of Akhila Bharatiya Grahak Panchayat. We are
Very nice,
conducting
sir.
awareness program in the schools for school. We are going on 9th. In fact, I just added in my last tips of this thing. Have Grandparents' Day at your school also, which has been followed at Mysore and other places. Anta. I was just typing.
Yes, sir. Thank you so much, sir.
Yeah. Thanks for your that valuable session. I just incorporated in my PPT. Have Grandparents' Day at your school also, which has been followed at Mysore. Thank you.
Yes, sir. Thank you, sir. Thank you so much, sir.
Thank you so much, ma'am. Regarding the digital literacy for elders, we will try to arrange one session on from the VMS.
Very nice. Very nice. It's essential.
Good.
Yeah, sure, ma'am. We'll
Make
try
it
to
more
contact.
practical rather than theory. Practical
Yes, ma'am.
how to use phones should be shown. Yes, sir.
Yes, ma'am. We will try to coordinate with the people, ma'am.
Thank you. Thank you so much. Thank you, sir.
Thank you.
Thank you, everyone.
Thank you.